The support and advice we give to patients recovering from treatment is mainly to help them wean off of a tube feed if they've needed a tube feed during the treatment and reintroduce a normal diet. So we begin normally with soft foods, moving back towards more solid foods and reintroducing different tastes and textures. The main things we need to discuss here are how to manage with a dry mouth, taste changes, and maybe some persistent ulceration.
I was eating quite normally because the dietitian was quite surprised how well I was eating right up to about 2 weeks towards the end of it. Then it started, I couldn't eat so much, and then bread was like, I just went about a bit of this table, or some mud, it just all, everything tasted the same and horrible. Then I couldn't swallow. Then it just had to be Ensures all the time. For about 4 or 5 weeks I didn't eat hardly anything.
With the dietitian's help, she gave me some supplements and also some advice on what types of food to eat. Very high in fats and everything the opposite to what you usually do eat. You have to eat to keep your weight up during the radiation and through your treatment.
Yes, one of the sort of side effects, the long-term side effects of the radiotherapy is the loss of taste. Because of the radiotherapy on my tongue, then I lost all sense of taste for quite a while. Everything just tastes of nothing really, it's like cardboard. Then slowly, taste started to come back. Sweet things, first of all. So I became a bit of a custard and banana freak. I was always eating bananas and custard, but anything sweet. And then slowly over the months, and it was months, when saliva started to appear again, which was a great high point in recovery, then flavour started to appear. And now, or after about 3 or 4 years, then they were almost totally back. So I was very happy about that. Food was enjoyable again.
Before the tube gets out, you try to start eating normal food. I have dry mouth and I have no taste. So it makes it certainly at the time, it made it very difficult eating certain foods, and you had a problem trying to find food for me.
We also provide practical advice for family members and carers, because obviously they're making most of the food and doing the shopping for patients during this time.
We try to make it as interesting as possible, and used to make lots of nice soups from fresh vegetables and what was around that could be nourishing for him. And to be honest, we didn't use that many supplements because we found our own home cooking was more tasty and we managed that very well.
Lots of things with gravy.
Lots of things with gravy, yeah. Juices,
Shepherd's pie, roast dinners.
Everything had to be covered in gravy so that I could get it down easily.
That was mostly pureed food,
Pureed
like baby
food,
food.
yeah.
You couldn't eat much to do
No.
with solids or things.
My daughter used to make me smoothies.
Spice burns, alcohol burns. So anything that burns the throat is really uncomfortable. And I'm now 4.5 years on from treatment, and I still have that problem with food. But I unlike some other people, I'm lucky in lots of other ways. I can eat meat.
I would really say that he's on the fish diet. He finds the fibre in the meat too hard. It dries and he can't swallow it.
I had to soften the food down and eat pasta type foods rather than like solid meats. But overall, I was fine with food.
At the end of the day, you can overcome these problems if they are problems. They're not really. Just a change of diet.